Erectile dysfunction is the inability to obtain and maintain an erection satisfactory for sexual intercourse. It's a terrible disease process that affects millions of men on a physical, but also on a deeply emotional level. It's a topic that has fascinated me for years. I've dedicated my career to understanding ED and helping my patients get the care they need. I am Dr. Samantha Nealon. I'm a genitourinary, reconstructive surgery, and prosthetics fellow at the University of Texas Southwestern Medical Center in Dallas, Texas. In this series, I'll take you on a journey where we'll meet 5 urologists across the country. We'll learn about the life-changing therapies that are available for erectile dysfunction. These treatments are restoring sexual health and giving hope. My goal is to shed light on a topic that has been in the dark for far too many years and to help more patients get the care that they need. This is hard. Today we're here in St. Louis, Missouri. We'll meet with Dr. Arnold Bullock, who's a distinguished professor of urology at Washington University and a longtime erectile dysfunction surgeon. We'll also meet his patient Cliff, who's had erectile dysfunction for over 15 years after his treatment for prostate cancer. And we'll have the opportunity to learn of a beautiful love story between Cliff and his wife Marilyn, and learn how their journey through the treatment of erectile dysfunction actually brought them closer together.
That's my favorite picture.
Really lovely.
I am married. I'm married 54 years. I don't know what life would be without her. She truly is my soulmate. When I was 58 years old, I ended up with prostate cancer. So I had the prostate removed, and then all of a sudden, I was not able to kind of have erections. I felt like I lost my manhood. I felt like there was a way you're supposed to do things, and I couldn't do it anymore. Like I had failed, you know, in being intimate, and it was devastating.
52% of men between the ages of 40 and 70 have some degree of erectile dysfunction. Unlike presented 40 years ago, that ED was a psychologic disorder, we now know that 90% of men who have erectile dysfunction, it's a physical disorder. Erections occur primarily because there's blood that's encouraged to flow into the penis. So if there's a neurologic injury where the message doesn't get to the penis, then there's no encouragement for the blood to flow. If a person has inadequate cardiac output, person had pelvic surgery, they could have nerve injury, a person with low hormone levels. There are many reasons for erectile dysfunction.
I went to my regular GP, and he said, we'll try these pills. But when they didn't work, I went back to him and did the same thing with the external vacuum device. And when that didn't work, I didn't do anything.
This was another couple that didn't realize that implants even existed. Because most patients only give 2 treatments a try. You really should present implants as your treatment of choice based on the facts. The facts say that it has the highest satisfaction rate. It's the one that most fits into a regular sexual experience, and it's one that people years later are still happy with.
The gentleman that did the prostate surgery for me had a partner who happened to be Dr. Bullock here in St. Louis, and invited us to a discussion on erectile dysfunction. And that's how I finally really learned that it is fixable.
If you're a couple that really are into each other and you're going to be sexually active on a regular basis, there's no therapy that's better than an implant.
It seemed to both of us that really answered the question about being able to have erections again whenever you wanted them.
I guess you have to see men before and after they get treated. And you see that the joy and the satisfaction that they have and how complete and how full they feel by fixing this problem.
It brought back the old Cliff. the Cliff she married. It brought back the intimacy and then some that we had lost. And she stood by me for the whole thing. ED is a terrible thing to face, and the only way you're going to face it is if you own up to it and talk to somebody about it. Because if you keep it to yourself, it's just going to eat you alive. And you don't have to be like that. It can be fixed, and you can have a life, a good life.
Love you. Love you too. Today was fascinating, really eye-opening for me, getting to sit down and talk with Dr. Bullock about his practice. He told me all about how his practice has evolved as it pertains to the devices he uses, the way he counsels patients, and the importance of outreach in our communities. He also continued to reiterate the emotional struggles that these patients go through to even bring up the topic of their erectile dysfunction. Many patients have trouble even bringing up their ED to their most intimate partner, and they're not alone. So many men are struggling with erectile dysfunction and dealing with those same struggles and emotions. I really want to thank Dr. Bullock, and thank you from the bottom of my heart, Cliff and Marilyn, for opening up your home to us and allowing us to come in and hear about your life together and your beautiful love story. Thank you. Today we're in Colorado Springs, where we will be meeting with Dr. Abram McBride, who is in private practice at Colorado Springs Urological Associates. We'll also meet one of Dr. McBride's patients who developed erectile dysfunction as a result of his diabetes.
So when I think about all the men with erectile dysfunction that I see in my practice, the majority of them have some medical condition or comorbidity that underlies or contributes to their erectile dysfunction. And I would say most commonly that would be diabetes. Diabetes is a microvascular disorder, so it can disrupt blood flow to certain organs, the eyes, the toes, feet, nerves, kidneys, but also the penis. And you can lose blood flow to the penis, but you also lose some of the neurologic connection between the brain and the penis in terms of arousal. And so it's important to recognize that when you see a man with diabetes who also has erectile dysfunction, definitely need to inform that patient of all the options that are available so that that patient knows there is a solution. There is a solution there that is going to be right for them.
My name is Andy Walker. I am 59 years old. I have diabetes. I'm a computer developer. I don't know when the ED first came on. We tried on numerous occasions, and I simply could not get it up. My low point probably came in some of the conversations where my wife was expressing how unsatisfied she was with our sex life. She didn't want to get intimate. She barely wanted to kiss me. It brought me to a very low point, and I was like, I've got to do something. So we Googled, we did research. We saw a urologist, and he put me on a couple of the medications and even had me try the vacuum device, but none of it worked. And eventually, I got the referral to Dr. McBride.
Hey, Andy.
Hey there.
How are we doing?
Dr. McBride.
Considering he had already tried and failed the pills, he had tried and failed a vacuum erection device. When I talked about the inflatable penile implant, he got very excited. The penile implant provides an opportunity to have one procedure to achieve perhaps a decade of durable restoration of your spontaneous erectile function. And so for Andy, he was ready to go. That's the answer that he was looking for.
I think it helped our relationship a lot. I was, putting myself out there. I was getting this done. I was undergoing this procedure that we knew was going to have some discomfort associated with it. But I was doing it for us, and she knew that. And so that helped strengthen our relationship. My point of view was like, this isn't my fault. It's something that's happening to me. And then we scheduled it. And that to me was a big deal, just the scheduling of it. And he reassured me about all of it. He told me exactly how it was all going to work. He recommended the AMS 700.
It has the most natural, concealed look and feel and appearance of all the penile implant products that are available. It's the only implant that has a impregnated antibiotic that has been well established in the research literature to reduce the likelihood of infection. And so for me, it's crucial to have a penile implant product such as the AMS 700 series LGX or CX implant with the inhibisome antibiotic to make sure we're minimizing the risk of infection as much as possible. And not just in healthy, normal patients, but also those with diabetes, those who are getting a revision of their penile implant, patients that we would consider to be potentially higher risk for having an infection.
And I had the surgery done, and I still remember the first time we made love after that. And just the amazing, wonderful feeling. I'm like, I could not even remember the last time I felt that way. It was like being reborn, honestly. We both felt a great deal of relief that we've gotten past this rather significant problem in our marriage. Now we have all kinds of intimate contact, so it's a general improvement in my whole emotional state. And I wish I'd have been quicker about it and more proactive. That is my one regret about the whole thing, is that I didn't get it done sooner. So don't hesitate to get the problem fixed.
He was elated. He was so happy with the result that, for years he had struggled to have this level of intimacy with his wife. This aspect of their relationship didn't exist. And now it was there whenever they wanted it. And so it was a fantastic improvement in his quality of life. And that for me is just fantastic. That's why I do what I do.
There were several takeaways from my interviews with Dr. McBride and his patient. Dr. McBride repeatedly circled back on the customization of erectile dysfunction therapy and how each patient should be approached holistically. Each patient presents to us with a different background, a different experience in their journey toward ED treatment thus far, and different comorbid conditions. So we're tasked as urologists to be more than erectile dysfunction doctors. We're tasked to see the patient as a whole. And I really hope that this video series can create a message that touches not only physicians out there watching, but also all the patients out there who feel like they're unheard and feel like they're misunderstood, and that perhaps they haven't had the appropriate counseling and education on erectile dysfunction that they've been seeking. Today we're here in Newburgh, New York, where we'll meet Dr. Jaspreet Singh, who is a private practice urologist with Premier Medical Group. We'll have the unique opportunity to follow Dr. Singh into the OR and assist him in a prosthetic case. We'll also meet his patient Robert, who is a construction worker in New York City and has become a quiet patient advocate for IPP surgery.
The reason I developed an interest in penile implant surgery or insertion of inflatable implants is being able to restore the confidence in a man to be able to engage in sexual activity is priceless. I mean, these are probably the happiest patients that I have. Being part of the success story is selfishly probably the biggest ego booster that I have. And that's, again, one of the reasons why I love prosthetics, right? Because at the end of the day, you're treating a person, not just a disease.
I go horseback riding. I ride quads. I enjoy just being out there, and it's a lot of open space. Probably about 5 years ago, I started to realize that something was wrong. I've tried the pills, they worked at some point, but they didn't work long enough. I went to Dr. Singh, and it's the best thing I ever did in my life.
When he heard that the implant surgery is an option that allows him to be independent, to be spontaneous, and to be able to really achieve an erection whenever, wherever, for however long he wants, it didn't take long for him to say, sign me up.
I didn't really probably go into this looking for an implant. You know, I went into this looking to talk to a doctor, maybe doctor give me some kind of special medication or tell me that I'm doing something wrong or eat different or whatever. And we went over everything, and this was the best thing for me. I felt a little nervous, basically not knowing how it was going to turn out or thinking about maybe there's a lot of pain, but excited.
The surgery itself is not complex. It is a fairly straightforward procedure. And in fact, in the right set of hands, a procedure that really should take about half an hour to 45 minutes. One doesn't have to spend any time in the hospital. So you come in, you have it done, you go home. As far as the steps go, it really is straightforward. The normal penis has two cylinders, so to speak. The spongy tissue we call corpora cavernosum that engorge like a spongy tissue. And all we're doing is we're placing two plastic balloons that go into that area, a pump in the scrotum, and a reservoir that holds the fluid. So at a flaccid state, the implant is relatively empty, feels and looks like a flaccid penis. Whenever a man wants to have an erection, he has the access to pressing a pump in the scrotum to be able to shift the saline from a reservoir into those cylinders and being able to have an erection. When a man is satisfied or partner is satisfied, there's a release button here that you press that allows the erection to go back down. And it's easy as that. I use the AMS 700 platform. The benefits that this implant offers is the reliability of the product and being able to treat erectile dysfunction for the next 10 years. The implant itself is impregnated in an antibiotic solution, what we call inhibizone. And it's really the only product that's out in the market that has this patented proprietary solution. And that is important because it has taken the risk of infection of an implant surgery and has significantly lowered it because that inhibizone allows a zone of protection for weeks to come after the surgery. From a patient's expectation to be able to restore an erection to as normal as it was before, I think that this implant offers that. And that's really what we're trying to do when it comes to implant surgery, is we want to get to as close of a natural state as possible. And that's what the AMS 700 really provides.
I still lift weights. I ride the quads, I go horseback riding, I run on a treadmill every day. You don't even know it's there. It's a wonderful thing. You know, it's comfortable. It really changed the way I felt about myself. You know, it changed me completely. It really did. I want to scream and say it works great.
The way Robert recovered physically and emotionally is how pretty much every patient recovers. The initial nervousness, all the way up to surgery, the sense of relief right after surgery, to then, doc, I should have done this earlier. And that really is day in and day out of guys who undergo the penile implant experience.
I really enjoyed spending the day here in Newburgh with Dr. Singh. He took the time to walk me through his surgical planning process as it pertains to patient counseling, his use of patient advocates, and modeling the devices in the office preoperatively to the surgery itself. He's built a really beautiful practice here in his hometown, for which he should be very proud. Surgery for erectile dysfunction is not a foreign concept. This is a viable solution to a common problem. We'll see you on our next episode of Hard. Today we're here in warm, sunny Phoenix, Arizona. We're going to sit down with Dr. Sean Blick, who's a private practice urologist here at Valley Urologic Associates. He's been in practice for almost 30 years and has a robust prosthetic urology practice here. We'll also sit down with one of his patients, Lawrence, who developed organic erectile dysfunction and now has a penile prosthetic.
Prior to the procedure, I just, did everything in the book to try to get erect. taking various, pills and stuff like that, it was really embarrassing for me to where a lot of times I just, I gave up. I didn't want any friends. I didn't want, especially women, I didn't want to have that because I knew that sexually I really couldn't perform. I say, you isolate yourself. And I went like that for many, many, many years. And then, I want to say, lo and behold, I woke up one morning and I urinated some blood. Made an appointment with my family doctor. He says, I'd like to refer you to this urologist. So, meeting up with Dr. Bullock and his people, all well and done, started feeling better. And then I brought up to him, hey, I got this other issue.
On average, in the community, it takes a person 6.2 years to use up the conservative measures and then find themselves to a doctor like myself who might be able to offer them a penile implant. Penile implant surgery is the ultimate solution, and the power of providing that solution and the impact it has on patients is extremely rewarding. It's on the order and power of like curing cancer when you give someone a penile implant and restore their ability to have sexual function again.
I wanted to find out, well, what are these procedures really like? How much am I going to get cut open? What's the scar going to really look like afterwards?
When I meet my patients and are advocating a penile implant, I go through a very detailed informed consent. I spend a lot of time trying to make sure they feel comfortable, that their questions are answered, that their reasonable expectations have been set. I will tell them, for example, that we do this through a 1-inch opening, very easy to heal that. I give them that messaging around the fact that when we're done with the surgery, they'll come back the next day, and when we look at them, and it doesn't even look like we did the surgery. That their recovery is modest. Again, mostly over by the end of a week, and by the end of 3 weeks, we're completely teaching them how to use the device. And then I get into the idea that this does not affect their sensation. This does not affect how they ejaculate. This does not affect how they orgasm. We talk about how it's invisible, that people can't tell they have it. It's discreet. It won't go off in the airport when they travel. And so I tell them all those things. I tell them that it's natural in the way it looks and the way it feels. So I tell my patients not to fear. I feel that I am extremely confident in the surgery at this stage in my career. I know I'm going to have a very high success, low complication event. I know I'm about to change their entire life.
Now I'm educated. Now I understood, what this could do for me, Now things started changing because now I didn't have that mental stress anymore because I knew that all this was just going to go away. And I'm going to tell you, once I was done and I got healed up, I felt proud of myself.
He went through it pretty smoothly. And by the end of a week, all black and blue swelling and discomforts were mostly gone. And he really didn't have a bad week. Patient was off pain pills by the end of the week. And then by the end of 3 weeks, he was completely healed.
No regrets, none. And I only wish that when I started feeling this way at the beginning, that my family doctor at the time I was seeing would have just said, okay, I'm gonna send you to a urologist. It changes everything. It's like the world flipped upside down and I was like a new man. And it's all because I made that decision and I was able to correct an issue that I had.
Sex is an extremely intrinsic part of people's happiness. The ability to have sex in a man's mind is almost as important as the sex. And so men who get penile implants, they feel happier, they have more self-confidence, they have more self-esteem, and they're so much more likely to engage in any form of intimacy because if it leads to sex, they can. That's really, really important to the man's psychology.
Today in Arizona has been a wonderful experience for me, getting to talk with Dr. Bullock. He's such a wealth of knowledge. His excitement for treating these patients is contagious. He really emphasizes the importance of communication. Preoperative counseling and informed consent for these types of procedures really drives postoperative outcomes and success. Managing those anticipations and anxieties and fears about surgery can really help the patients be more comfortable with having a penile prosthetic. And also to our patient, Lawrence, thank you for being so vulnerable with us and telling us a little bit about your story. Today we're here in Houston, Texas. We'll be sitting down with Dr. Jonathan Clavell, who's a private practice urologist at Clavell Urology. We'll also get to meet one of his patients, Richard, and Richard's wife, Maria. We're going to hear their special story about their journey as a couple through erectile dysfunction. We're going to learn about the emotional recovery after prosthetic surgery and all that it entails.
I'm married to Maria. We met through a mutual friend.
I mean, we clicked from the beginning, like, where have you been all my life? And we dated for a week and so, and then I moved in with him.
Kind of, everything went fast. I love her, so I'm not regretting anything now.
It was the beginning of something, the most beautiful thing I've ever had in my life, so yeah.
I hid it for years. Even to Maria, I didn't tell her nothing at the beginning. I was kind of afraid that she'd go away because I have ED. I think I was on my 30s. I started early. I was taking pills without she even know, and it was working fine. We were having sex also almost every day, and everything was perfect. But then pills sometimes, though, at the beginning worked, but then been a lot of years, so I stopped working.
All of a sudden, 2 years into the relationship, it's like, I want to be intimate with you. And he's like, oh, I'm tired. Oh, I had a long day, you know. We went out, we did this, we did that. I'm too tired. And I'm like, this doesn't sound like a happy man. So I sat down with him and I told him, I need you to tell me what's going on. And that's when he told me about his problem. And I was like, we could work through this.
That's when I started seeing doctors. So my regular doctor, he sent me to urology. They give me like electricity therapy. That thing doesn't work, so I went to see like a natural doctor. They give me some natural pills and stuff like that, give me shots. And I think I was doing a lot of stuff to make it work, but it wasn't working the way I want to. It made me more stressed. I was sad. I don't know what to do now.
He was desperate to find something, a cure for his problem. And I know that had to be painful, having to hide and wanting to do something for yourself, and you can't because you don't have, the options, you don't know anything.
I was seeing 3 or 4 doctors. I didn't see no answer. And I said, I want to get it done, but I want to get it done with the right doctor because I want to make it work. And that's when I found Dr. Clavell.
Why do men have to go through this entirely painful process of failure over failure over failure when we have something that can actually solve the problem for them? Richard was a young man with really no medical comorbidities. He was a pretty healthy guy. However, he had erectile dysfunction for many years. We did the penile Doppler duplex ultrasound, and he did have problems with the blood flow getting into the penis. So he did have a physical problem that was just localized to his penis. Once we started chatting, that's when I started, noticing a change in his demeanor.
I think this is it. I just found now what I need.
Once he got the whole information and he said, I'm gonna go through with it. I mean, you saw it. It was a drastic change for him.
The emotional recovery of Richard actually started the day of the surgery. Before I even, got him into the operating room, you could tell he was high-fiving me. He's like, hey, doc, I'm excited about this. He felt worthless. Now he feels worthy of a relationship. Now he felt hopeless. Now he's hopeful.
The first time we were intimate after that, it was like, wow. So how does it work again? Where is it again? Because it was like nothing. Like he didn't have anything. It was just completely normal. It was, I was amazed.
I don't have no more stress anymore about it because now I know 100% it worked. And now I can say like I can be with her the rest of my life.
The biggest benefit that most men get out of this surgery is actually how their emotional health can actually improve. That's what reminds me of why I got into this field. There's many doctors that focus on adding years to a patient's life. My goal as a men's sexual health specialist and with penile implant surgeries, we want to add life to your years. One thing that's exciting when it comes to penile implant therapy and the fact that I'm young, right? I'm a young surgeon, is the fact that I will be there for when technology continues to improve. When I think back to what has happened in the past 10, 15, 20 years and where we are right now, the only thing that I can think of is like, I'm excited about what the future holds for penile implants.
I really enjoyed meeting Dr. Clavel. He emphasized the importance of owning the responsibility that we have as urologists. We can take away that physical roadblock and open up that emotional recovery and restore the spontaneity of youth and love. I really want to thank Dr. Clavel for having us today. It's been a pleasure. Thank you for opening up your office to us. Thank you so much to Richard and Maria for opening up your hearts to us and sharing your story. That's going to help so many others. It's been so eye-opening for me to see just how real the pain of erectile dysfunction is. It's a fight, a struggle to understand and to take action. We've heard time and time again how inflatable penile prosthetic surgery has restored confidence, hope, and intimacy. Many relationships have found a new vibrancy after IPP surgery. For physicians, we hope that hearing these stories gives you the tools you need to recognize the early signs and symptoms of erectile dysfunction and refer your patients to appropriate specialists. For patients, we hope that these stories give you the confidence to be your own advocate and feel empowered to go out and seek the care that you need. Maybe by seeing a little piece of yourself in these patients, you can avoid their same struggles and get the care that you need faster. We can solve ED together. Now let's get to work